This is Becky from More Than Borderline, and today I'm talking about myths about addiction treatment. Did you know there are a lot of myths out there that keep people from seeking treatment in the first place? I've always found this interesting because approximately 70% of all mental health consumers have a drug or alcohol problem of some kind, and this is especially true in borderline personality disorder, where addiction may be one of the criteria for having the disease. So today, I'm going to talk about the myths that may keep us from seeking treatment. Myth number 1, treatment is one size fits all. Myth number 2, if you have tried one rehab program, you have tried them all. And myth number 3, individuals that use alcohol or drugs after treatment are hopeless. First up is myth number 1, treatment size is one size fits all. Did you know the most successful drug and alcohol treatment programs tailor their program to the needs of each individual client? Some are going to need more therapy than others. Some will need different medication than others. It's all up to what the individual's needs are. It's not one size fits all. It's like clothing. Certain things will fit certain people, but not other people. It all comes down to what the individual's needs are. Did you know that even when it's the same substance, different people will respond to the same treatment in different ways? That's why treatment can't be one size fits all. It all comes down, as I've said before, to the needs of the individual. Myth number 2, if you've tried one rehab program, you've tried them all. Not so. There are short-term, long-term, residential, outpatient, and inpatient programs, among other options. The type of treatment an individual chooses depends on the amount of time needed to learn the skills necessary to maintain sobriety. This varies from individual to individual. You didn't develop the problem overnight, you're not going to develop the cure overnight. Studies have shown, according to the Gatehouse Academy, that the longer someone stays in treatment, the higher the success rate. A month or two is usually not enough. 6 months to a year of residential treatment is the minimum amount of time most people need, followed by transitional living and an umbrella of support once the individual returns to mainstream society. For example, I spent 4 months in a dual diagnosis unit in the state hospital system here in Indiana. Then I spent 9 months in a borderline personality disorder treatment program. Then I spent about a month in a group home, and now I live in an apartment and have for several years. It all comes down to how the individual functions in treatment. Rehab, like other forms of treatment, needs to be tailored to the needs of the individual, and you'll get different results depending on the individual. Myth number 3, individuals that use alcohol and other drugs after treatment are hopeless. Addiction is a disease. It's a chronic disease, and relapses may occur. In fact, when I was at Richmond State Hospital, dual diagnosis unit, they often said a relapse is part of recovery. It doesn't mean you're going to hit rock bottom. It doesn't mean you'll never again be sober. It just means you've made a mistake. Now, what can you learn from that mistake? Many of the myths about addiction and recovery make it difficult for us to get into treatment. That's why these myths need to be dispelled. In order for us to get into treatment, we have to believe it will work. That's all I have to say for now. It's up to you what to do with the information I've provided.